This is a very holy time of year for so many New Yorkers. People are celebrating Passover. Today, Good Friday, Easter to Sunday, for so many New Yorkers. It is a time of year that in normal times we look forward to, we plan the whole year around. And what do we think of? We think of not only faith and not only tradition and things that guide us in good times and bad, but we think of our families. We think of those gatherings that are some of our fondest moments every year, the things we really remember and feel throughout our lives. Every one of us, when I say to you, think about Easter, think about Passover, you have memories going back to your whole life, your childhood. And for the first time that I can remember, for so many families, we can't do that. And thank God people are using, FaceTime and Skype and Zoom and whatever they can get their hands on to connect with each other, but it's not the same. It's painful to not have that closeness to each other the way we're used to. But there's something about this time of year that I believe is fortifying and strengthening New Yorkers, because we're listening to the meaning of those stories, of Scripture and of all the traditions and of all the family rituals, everything that we've known all our lives in some way prepared us for today. And when you look at faith and you look at the lessons, so many of them are about people fighting adversity, fighting overwhelming odds, trying to find something in themselves that was strong and good even when faced with massive challenges. And the message through all of our faiths is to love each other, to support each other, to be charitable to each other, to understand each other, to feel empathy for each other. All of the faiths come back to that. So this is a time that we could be angry. We have every right to be angry and frustrated. We can't do the things we're used to. And we need our families right now so much, and we can't have that connection the same way. And yet, all that we've learned from our families, all that we've learned from our faiths and our traditions was telling us exactly how to persevere in a moment like this. To dig deep and find that wellspring of hope and belief and that ability to be there for each other. And that's what New Yorkers are doing. I keep saying the heroes are everyday New Yorkers who are finding a way to do things that I think we would have thought literally impossible. The people who turned this tennis center into a hospital in a matter of days, the people every day are protecting and serving us, the first responders, the health care workers, all these people going so far above and beyond. But it's the everyday people who are helping us turn the tide and fight back this disease. The everyday people deserve credit too. Everyday New Yorkers who are taking to heart this common mission. 8.6 million people, the most diverse place on earth, with one goal in common: to fight back this disease and save each other. That's what I'm seeing every day. And then to know that help is always coming from the rest of our nation, that only reminds us further that our faith is well placed in each other. So here we celebrate, against a backdrop of pain, the goodness in each other. And it brings us right back to this place that was a tennis center and now is a hospital. So we're right here in the epicenter of this disease, and we've learned a lot the last few days. Sometimes we face a challenge or a crisis and we say everyone is equally affected. Sometimes a crisis is the great equalizer. Well, that's not true with the coronavirus. Yes, every community is affected, no doubt. Every zip code, every neighborhood, so many families of every background. True, all of New York is suffering. We all know someone who's been lost. We all know people who are sick. We all know families that are suffering. But in the last few days, the disparities are sharper and clearer than ever before. And unfortunately, this disease has found every problem in our society, every inequality, and gone right deep into it and exacerbated it. And so here in Queens, we see that folks who are low income are suffering. Folks who have not had enough access to health care because health care is still given out according to how much money you have in this country. And especially immigrant New Yorkers have suffered, some because of language barrier, but many, I am convinced, because they've been pushed away in recent years from the support that they deserve just as human beings and New Yorkers. They've been told to be afraid because of what's happening all over our country. A lot of them have been so fearful, whether it's an ICE raid or any effort to take away their rights, their benefits, the things their family depended on. And a lot of folks have turned inward out of fear. There's no question in my mind that's part of what's happening here and part of why this part of Queens has been hit so hard. Everyone at Elmhurst Hospital, Queens Hospital have been just amazing heroes in this fight. We need to support them all the way through. No one thinks this is going to be over soon. It's going to take a lot more fight. But getting them some relief, a place like this to draw off some of the patients, getting them the military medical personnel who have served so nobly already, all of that is helping us against the backdrop of those horrible disparities. It's helping us to make sure that one thing is fair and equal, that every New Yorker will be treated the same. When they come to get health care, they will get it regardless of zip code, regardless of background, regardless of ability to pay. No one will be turned away. That's what we believe, and that is what we are doing.